structure of the debate is designed to flow as a conversation between group members. I will be introducing a topic as the introducer, then flow into the con section. Once the con section is complete, we'll transition into the pros and then wrap up with a conclusion. Once at the end, there will be a review of common questions in connection with the information that was covered within the debate. Okay, so how the roles are going to play out is that I'm the introducer. I'm going to be introducing the topic and to summarize in the beginning. Working together as summarizer, illustrator, and researcher for the con side will be Lindsay and me, Emily. Working together as a summarizer, illustrator, and researchers for the pro side will be Allie and Brandy. In conclusion, the wrap-up, Lindsay will have a brief wrap-up of our decision on what we concluded as the answer to the question. And the fielder will be Allie, and timekeeper will be Brandy. Okay, let's get started. Our topic is whether the mandate free and appropriate public education, FAPE, should include mandatory ABA services for children and youth with autism in schools. There are many ideas and mentalities and options when discussing what children deserve in a school setting. However, each and every one of us most likely would agree that children deserve the very best opportunity within an educational system. According to Individuals with Disability Education Act, IDEA requires states to provide a free, appropriate public education for each individual need. In fact, another mandate, the Free and Appropriate Public Education, FAPE, requires educators to provide the highest quality individualized programs and other specialized services to promote academic development. As our group, and through research collected, by providing ABA services, professionals are able to utilize valuable tools that not only really decrease problem behavior, but increase productivity. So your children are going to be doing much more in school when there's less distractions and there's more control of what the children are actually doing. However, with every professional service, whether it be an ABA professional, a principal, a teacher, there are many negative views that need to be reviewed before considering any other specialized services. In spite of the negatives and ethical issues, much of the research continues to point toward ABA in schools. We want our kids to learn. We want our kids to thrive. And when there's distraction and then there's behavior problems in the classroom, many of the productivity and learning environment, the quality is decreased. And again, if we go back to FAPE, that's providing the best quality education for our students. And behavioral problems, as you and I both know as educators, can cause many distractions and reduce productivity, hurting the overall learning environment. By implementing the principles of ABA, professionals implement life-changing tools that have the potential to alter the outcomes of children with special needs. It's very life-changing, and ABA really only has positive effects, especially in a group setting. So we're going to go ahead and start our con section.
There are some theoretical and practical issues of including ABA in special education. This is our con section, as Emily mentioned. The theoretical and practical issues that we'll discuss include the negative image of ABA history, an unwillingness to change behavioral procedures within the school setting, insufficient information being provided on what to do in the moment when behaviors occur, and the difficult and ambiguous terms and overuse of jargon in ABA. The first is the image of ABA over time has been generally negative, which may hinder acceptance of ABA in the field. and this is according to Axelrod, Moyer, and Berry. For example, in ABA history, a lot of times punishment procedures were used. For example, in ABA history, a lot of times punishment procedures were used. Some procedures were tested on animals and then on humans. And also there were some facilities in history where the patients were restrained or shock therapy was used. But now ABA requires that evidence-based practices be used. Also, there's a strict following of the Code of Ethics that must be implemented. And they strive to use reinforcement procedures over punishment procedures. Not wanting to change disciplinary procedures is another reason why some educational professionals do not want ABA in the schools. According to Skinner and Hales, the resistance occurs when updated and evidence-based methods are offered. A lot of times, senior employees are not accepting because of their experience, and they believe that they already know how to decrease problem behaviors, so they don't want to be told of what to do differently. Also, a lot of people are afraid of the trainings, that they can be time-consuming, but they can also be difficult to implement school-wide. Interventions are written for frequently occurring behaviors, so teachers are afraid of having ABA in the schools because they are not sure what to do when new behaviors occur. So a lot of times the children have behavior plans written for specific behaviors, but the teachers don't know what to do when something new happens. For example, if a student has a behavior plan for hitting, but then steals something from another student, what's the intervention for that? There's also behaviors that occur for children that don't have behavior plans. So ABA is pretty used to dealing with the individual rather than what will work for a whole group. There are also some negative views about the terms used in ABA. This is according to Axelrod, Moyer, and Berry. Punishment and negative reinforcement can be misunderstanding, and those are terms that are often used. A lot of people think that punishment means scolding or timeouts or spanking, when in actuality in ABA punishment means decreasing behaviors. Also, negative reinforcement is a term that can seem wrong because people might think of negative as bad or harmful reinforcement, when it actually means something is removed which causes the behavior to increase in the future. School professionals are also not too fond of the overuse of positive reinforcement. Sometimes it's difficult for teachers to reinforce all positive behaviors and ignore the negative behaviors. For example, peers can make it difficult to ignore negative behaviors if they're laughing or talking about the undesired behavior. Also, there's often an overuse of jargon, so there are terms that are not defined in a behavior plan, and this could cause the intervention to be implemented incorrectly. Along with these theoretical and practical issues involving ABA and special education, there are also some ethical dilemmas facing special education and other professionals who serve students with autism spectrum disorder.
Okay, so it's my turn. I'm going to be talking about the ethical issues and dilemmas that face special education professionals. This is very current, very relevant, and when I discuss this and when I'm talking about this, I want everyone to really put themselves in a teacher position and a professional principal position. Just start thinking about how you would feel answering questions within your mind, and also creating some questions of how you would feel, how would you deal with certain situations. So we're going to first off talking about why we have ethics and why it's important, and so the importance of ethics basically is to help support fundamental decision making within practice. ABA has ethics, schools have ethics, special education, even doctor's office. These are guidelines that protect the professional but also ensure that the client's needs are being met, that the client is being provided quality care, and responsible decision making from the professional is being provided. And then also gives clear guidelines. We're going to say clear guidelines to what is expected from the professional. All right? So let's review a little bit about IDEA and FAPE. IDEA requires the states to provide free and appropriate public education. Please keep in mind the word appropriate. All right? And let's talk about FAPE. Requires educators to provide the highest quality, individualized programs and specialized services from academic development. So please keep in mind the word quality for two of these mandates. So we're going to first talk about, we're going to go through 4 ethical dilemmas, and there's going to be many questions, like I said, that I'm going to state that my research I have collected during my research. So the first ethical dilemma is the subjectivity and the requirement of moral decision making. There is a gray area that is kind of in between the IDEA and FAPE. Many questions arise when it comes to interpreting these mandates. And often, a lot of these decisions that are being made about the child's well-being and what direction and the skills and the goals are really on the teacher. And the teacher is supposed to know, of course, what the child, where he is at, where she is at, and where they need to go, as far as skills and academics. However, there's a lot of ethical dilemmas that a teacher can face during this. So, like I said before, reiterating myself, Individual Disability Act requires a state to provide appropriate public education, a free and appropriate education. And if you think about it, for each individual child, that's a lot of needs. And everybody wants, like I said in the beginning, that everybody wants the best quality care for their children. I want it, everyone wants it. However, what does that mean? How would you as a professional interpret these mandates? Do you think that the mandates are written in a way that could be misinterpreted? Do you think the mandates sound too broad and vague? According to Court Aid and Ludlow in 2008, many IEPs and special education decisions are left up to the teacher to exercise objective professional judgment. But the professionals also often use personal judgment and morals to make decisions. So we're looking at these mandates. We're interpreting, the teacher is interpreting these the best they can. In fact, there are many situations that occur that special education professionals, there's not really a clear answer. So they have to do their best, taking from data and information, the assessments and the behavior in the classroom, and from the art teacher and from the parents to create this IEP that's quality. But also remember, we're the appropriate word in these two mandates, appropriate versus quality. As a result, educators are required to rely on objectivity at the same time as using your personal morals to make significant decisions that have life-changing effects. I don't know about you, but that's a lot of pressure if I was a special education teacher. Unfortunately, this quality education is often watered down to basically making the school only provide sometimes the bare minimum of treatment. Basically, this is an awesome statement, basically that actually a special education teacher told me. Basically, the school promises the Chevy, but not the Cadillac education. They're going to get you where you need to go within their interpretation of the law, but not give you the most luxurious education ever. So a parent can go to the school board and ask, my kid really needs an iPad. He really needs it, and give all the reasons why. But if your teacher doesn't think you need it, or it's a luxury item, you're probably not going to get it. Because, like I said, they're going to provide you with the education, the meat, to get you where you need to go. So again, appropriate versus quality. What's appropriate gets you where you need to go versus quality. You know, everybody has different interpretations of what their child deserves and what they need to be successful. The second ethical dilemma, challenges when implementing and creating programs. Okay? Within this section, this is going to be mainly questions and ethical questions that teachers that I have collected through research of this project that many teachers have come up with and what they face every day. So follow along with me. Not follow along because you're not reading, but anyways, creating appropriate goals. What is appropriate? Should that be left on the special education professional? Do they need more training? Another huge point is functional teaching versus life skill training. Should the child need division? And when the teacher knows they've hit a ceiling, maybe they should be taught to learn to cook, maybe learn to manage their hygiene. So this is left on the professional. So often the parent thinks differently, right? The parent wants the child to be in a regular classroom, to be with other kids and to learn division, hypothetically, but the teacher sees that it's more functional for them to learn life skills than division. That's an example. So what is the most beneficial for the teacher? For the student. What's the most beneficial? What's going to help them? What skill is providing the highest quality education? What skill is going to generalize the environment? And then also, who is going to provide the training? Who's going to guide these students or even these teachers to provide the appropriate education and creating appropriate programs? So now the third dilemma are assessments. A few other debates have talked about assessments with older people living independently, that there's not enough assessments, the appropriate assessments. Well, there's not enough assessments or appropriate assessments for students in schools. Special needs children have multiple needs, which require professionals to develop assessment tools that can measure where the student is, where they need to be, and how much they have learned throughout the year. Okay? Many ethical dilemmas can arise. Again, the development of these assessment tools are left up to the teacher to create. Is this too much? What's the training? Each teacher might have different training than that next teacher, right? There are too many questions that often arise when untrained or undertrained teachers are challenged with creating appropriate assessment tools. And let's talk about it again, the programming. All of these ethical dilemmas blend into each other, that the teachers don't have enough training, there's too much responsibility, and there's too much gray area. All right? So when we're talking about assessments, here's the questions. Please keep in mind, what is a good measure? I need to be able to measure how far the child has developed since starting school. What's a valid measure? If I create an assessment tool, is it telling me what I need to know? Is it giving me valuable information? Is it assessing where the child is and needs to be? Next question, last one for this section. Does a child need an aid? Children use aids all the time. Do they need it for the assessment? And if the aid is provided, is that even a valid measure? For example, a child has a hard time writing, okay, and they have an assessment, they have an aid that writes down what the child's saying, the answer. Is that really a valid measure where the child's at? If the child's not even writing the answer, and the aid is? So keep that in mind. Our last dilemma is training. There's clear lack of training in special education personnel. Even special education in the higher ups, when vocational rehab, and just to see how to provide how to provide to what the special education children need. So there are hundreds of disorders, and to know how to provide services for each one would be impossible. However, that's the greatest behind ABA. ABA works in a variety of disorders, not just autism. So often children have multiple disorders and needs, which requires specialized training. This again is often left up to the teacher to figure out how to deal with this child while somehow providing the most quality education. According to Courtaid and Ludlow, 2008, the mandate idea requires highly qualified teachers, i.e., individuals who have been trained and have knowledge and skills to meet the needs of the students. However, the decision of how and whom to train can open up educational professionals to ethical dilemmas. We're concluding now in the last questions with the training. Keep this in mind. How do we prepare teachers for such a diverse community of disabilities? Should one teacher be trained to lead the others, or should multiple teachers be trained? Should the school hire an outside consultant? Should that consultant be responsible for training staff? How much can the county even afford to spend? And who's going to track the fidelity of treatment? In conclusion to the ethical dilemmas for special education, there are many questions that professionals are encounter on a daily basis. The main question is training worth the time and money to teach special education teachers how to implement ABA? ABA is complicated, requires immense amount of training. Even if training was provided, who will be responsible for maintaining the fidelity of each teacher? So please keep in mind these questions as the presentation continues, and I hope you enjoy.
So like Emily and Lindsay said, we have all of these ethical dilemmas that face this decision we're trying to make. Should IDEA and FAPE include ABA services for children with autism? Emily and Lindsay just presented reasons why it would be difficult, or ethical dilemmas that combat implementing ABA for children with autism. But ultimately, all of the positive aspects that ABA would provide outweigh these negative aspects. One reason to support all children with autism spectrum disorder having access to ABA services is that these services actually allow children to more easily assimilate into the general education classroom. There was a study published by the Journal of Child Psychology and Psychiatry that claims that children with autism spectrum disorder who receive special education services from an early age may actually lose their diagnosis. In response to that study, Autism Speaks Chief Science Officer Jerry Dawson stated, "We know that high-quality early intervention optimizes the outcome of individuals with autism. While only a minority of the children will lose their diagnosis, the study shows that these positive outcomes are possible. This then offers hope and underscores the need to continue to advocate for better access to early intervention for children with autism." So we have this study that's saying that children with autism who receive early intervention services may actually lose their diagnosis. Because ABA provides these supports in curbing behavior and teaching new behaviors, it actually will allow children to be part of the mainstream setting, which is what IDEA and FAPE ultimately want. Another study that supports this was published by the Journal of American Academy of Child and Adolescent Psychiatry. This study was looking at children diagnosed with autism spectrum disorder who were between the ages of 18 months and 30 months, which falls under the early intervention age. This study lasted for 2 years, and each week the children would receive 15 hours of one-on-one early intervention. The results from this study showed that these early intervention services help improve their intellectual ability, and it reduced autism symptoms even years after the intervention ceased. So even with these impressive results from ABA services, the positive influence doesn't stop there. Researchers went back 2 years later, after the interventions had stopped, and found that children who received one-on-one care saw their autism symptoms reduce even further. So obviously, the effects of ABA treatment provide children with ASD the hope for a better life, but according to Annette Estes, who was the lead author of this study, she says that the treatment is also financially beneficial and economically beneficial. She stated that people who are better able to communicate, care for themselves, and participate in the workplace at greater levels will need less financial support in their lives. So these early intervention services of ABA, if they're lessening the overall financial support needed for children diagnosed with autism spectrum disorder, this becomes even more a substantial support for these services being provided under FAPE when we examine the dramatic increase of children who have been diagnosed with autism spectrum disorder in recent years. So we have a graph that is just going to show how many children have been diagnosed with autism spectrum disorder who receive accommodations under IDEA has dramatically increased. So as we're looking at this graph, the U.S. Department of Education has collected data over the years on the number of students aged 3 to 21 who are diagnosed with ASD and receive services from the Individuals with Disabilities Act. In the year 2000, 93,000 students received services. Since then, the number has grown to 455,000 students as of 2012. As the number continues to rise, ABA treatment being an option within the school system would greatly aid this population. However, the benefits would not stop there. Parents, teachers, and administrators would all receive valuable training that would better equip them to educate students diagnosed with autism spectrum disorder. So some things we need to think about when educating students diagnosed with autism spectrum disorder. It's important to look at the laws that are already in place to support their needs. The 1997 amendment to the Education of the Handicapped Act requires that all children with special needs receive education within the least restrictive environment. The least restrictive environment is defined as requiring the child, to the maximum extent possible or appropriate, be educated with children who do not have disabilities. So educated in the same class that they would be in if it were not for the disability. So for many students, even students with ASD, ABA services are needed to achieve this. ABA principles and techniques can foster basic skills such as looking, listening, and imitating, as well as complex skills such as reading, conversing, and understanding another person's perspective. Without the support and treatment of ABA, many students with autism could not be successful in the general education classroom, which is the optimal least restrictive environment. So those are just a few reasons why ultimately we're supporting the implementation of ABA for children with autism spectrum disorder. So now we're going to present a few other findings that also support from our research.
Okay.
Okay. As Allie and Emily and Lindsay have discussed, ABA would be a huge benefit within our school systems. But within ABA, you have to question, as Emily pointed out, you have to question, are the teachers going to be trained? Is one teacher going to be trained? All the teachers going to be trained? Is there going to be somebody who oversees this program? This is where the BCBA joins as a collaborative partner. The board certified behavior analysts are beneficial as collaborative partners for many reasons. Some of these reasons include their extensive training on behavior analysis, as well as interventions and behavior measurements. Having a BCBA on staff within a school system to provide ABA services would be beneficial not only for the students, but for the teachers. So it's decreasing the amount of work on the teachers, which Emily went into a lot of detail on. The teachers are expected to do all of the things from data to implementation. And when you have the BCBA on staff, they can train these teachers to do those implementations and they can even help with taking the data. They can help with many more aspects. Throughout the research presented in many studies, the BCBAs are valuable in assessing the functions of behavior, providing implementation procedures for other staff, as well as providing necessary training to other staff members. According to Anderson and Kincaid in 2005, schools usually use a method where the consequence is applied once the problem behavior has occurred. So, for instance, Johnny screams in class, so he goes to the principal's office. So he did the behavior. Once behavior was completed, the teacher sent him to the principal's office. So within the school system, the consequences are limited to verbal reprimands, detentions, or visits to the principal's office. The use of the consequences is reinforced because the student's undesirable behavior immediately ceases. However, the behavior is no less likely to occur in the future because of the consequences, and oftentimes it increases. So Johnny yells out in class, gets sent to the principal's office. Well, it immediately stops that behavior. But next week, Johnny yells out every day in class, and every day gets sent to the principal's office. So what the teacher is using as a consequence is actually reinforcing the behavior because Johnny is escaping class. So Anderson and Kincaid in 2005 state that schools may actually be positively reinforcing the problem behaviors by using the above stated consequences because they are providing individualized attention or escapes from aversive stimuli. Since these programs are not effective, the use of behavioral interventions would be a valuable alternative form of consequences. School-wide positive behavior support, or SWPBS, would be beneficial when applied to all areas of the school to help prevent the development of the problem behaviors, to decrease or extinguish current problem behaviors, and to increase positive social interactions between the students. With the support of using positive behavior interventions, board-certified behavior analysts are a valuable tool for teaching effective behavior interventions. School-wide positive behavior support has been used in schools across different settings and not only proved effective, but also showed generality. When implementing school-wide interventions, board-certified behavior analysts become an important collaborative partner. Bailey and Birch, 2011, provide information on how the BCBA is unique to the collaborative partnership because BCBAs may work with the whole team. So they aren't just specifically, working with a child, but they're working with the team as a whole. So the teachers, the general education teachers, as well as the special education teachers, even psychiatrists, the parents, anybody who is involved in that child's immediate, system, they would be working with. And if this was used in a school-wide scenario, the BCBA would be working with the team of the school to help establish the seriousness of the problem behaviors, as well as collect the baseline data on the behaviors and complete the functional assessment. After the BCBA has defined the controlling variables, they design the plan of treatment. Once this treatment has been approved, then it is implemented. In order to ensure effective implementation of these interventions, such as school-wide positive behavior support, the BCBA will train the team involved on how the procedures should be implemented. This step is important to the process because behavioral interventions are most effective when they are implemented with congruency across all settings and all team members. So you don't want to have the teacher doing something different for the same behavior at school that the parent is doing something different at home, because the consistency is what helps generalize it. And if you have the teacher allowing the child to scream out one time in class before he gets to escape, but then the parent doesn't allow the child to escape at all, it's not going to generalize into the school setting. So Sheridan and excuse me for butchering this name, but Cotachwell, 2010, established that the objective of a partnership between members of the team, such as between school and family, is to ensure that children's learning is developed and strengthened across different contexts. According to these authors, students who experience congruency across different settings and people, such as home, school, therapy, teachers, parents, and so on, will transition between these changes in people and settings more smoothly. In fact, the three goals of a partnership are to create meaningful roles for the parents in the child's learning, promote continuity, and enhance the competencies of the participants involved. BCBA carries the most importance as a collaborative partner when it comes to training the teams. So here we hear that word training. And when we talk about teams, it's not just the teachers, but also the parents. The BCBA can work to train the entire team on how to implement and appropriately and congruently implement these interventions, as well as overseeing the implementation and collecting data. The BCBA is adequately educated on conducting a functional behavior assessment, or FBA, which determines what the motivation for the behavior is. The BCBA is not necessarily involved to implement procedures on their own, but to specifically train the members of the team in the ABA procedures. This means that the BCBA is not necessarily working around the clock, nor getting paid around the clock when you're looking at the financial aspect of it, for these implementations of the interventions, because they are simply training the already involved staff and family members to proceed with the interventions that have been deemed necessary. According to these three sources, BCBA is important to the collaborative relationship because they mediate the intervention across all team members by providing appropriate training and oversight, as well as data collection, and thus they help to diminish the load that is placed on the teachers and the family as team members.
Based on the laws established to promote the betterment of education for students with special needs, it is clear that students with autism spectrum disorder receiving supports for ABA services would fall under these laws. Despite the arguments against the implementation of ABA in schools, the studies presented show that the cost-benefit ratio reigns in favor of mandatory ABA services being provided. Students with autism spectrum disorder who receive early intervention services of ABA will be better assimilated into the general education culture, as well as having an established groundwork of necessary skills that provide the building blocks to continue learning for the remainder of their lives. ABA services not only provide immediate benefits within the classroom setting, but they equip students with autism spectrum disorder to live better lives past graduation. Despite the practical issues and ethical dilemmas, research has shown that ABA is the best known educational strategy for children and youth with autism and has the strongest evidence supporting its implementation as a mandatory service provided under FAPE. Overall, our group is in favor of ABA services in the schools.
So in doing this project, doing all of the research, we along the line came up with a few questions that we in turn had to look up ourselves. So we thought they would be beneficial to discuss with everybody, make sure everyone's on the same page. So one of the first questions we come to are, why are ethics so important in a medical profession or professions in general? And ethics are simply the guidelines that are designed to navigate professionals through fundamental decision making. These established principles ensure that the client's needs are being met and upheld while the professional's decisions are being protected. An ethical code makes certain consumers are being provided with quality care and responsible practices in accordance with the best interests of the client and the profession. A second commonly asked question we came about was, in regards to the mandates, IDEA, and FAPE, what often occurs after reading these? Well, if we're looking from the view of the parent or the family or some professionals, we find that the laws are frequently misinterpreted. The people reading them often do not understand what exactly is being provided for their child. So when the school's looking at it, they often think bare minimum, that the bare minimum is sufficient for the students. And like Emily mentioned, the school administration may promise you the Chevy, which is reliable, but they're not promising you the Cadillac. So you might not get the most luxurious education, but you're going to get a reliable one. It's going to get you where you need to go. Also, what often occurs is that too much responsibility is left to the teacher, especially when teachers do not have sufficient training to make life-changing decisions. One of our big supports for implementing ABA for children with autism spectrum disorder was that the early intervention services are what provided these substantial results. So, if early intervention ABA services are key, how early can one detect a diagnosis of autism spectrum disorder? We found that though autism cannot be definitively diagnosed until about 18 to 24 months, research shows that children as young as 8 to 12 months may exhibit early signs. So parents should look for symptoms such as no back and forth sharing of sounds, smiles, or other facial expressions by about 9 months. There's no babbling or back and forth gestures such as pointing by 12 months, or any loss of babbling, speech, or social skills at any age might be signs. A fourth question, our final question that we've come about, is why are professionals involved in special education opposed to having ABA in the schools? Well, we found that some professionals working in special education are opposed to ABA for a variety of reasons. These reasons could include the negative image of ABA history, an unwillingness to change behavioral procedures within the school setting, insufficient information being provided on what to do with problem behaviors when you're actually in the moment, so things that aren't planned for, and the difficult ambiguous terms and overuse of jargon that often occurs within ABA.
Okay. All right, I'm going to briefly show our references real quick, and then we'll be done with the presentation. Let's see here. Can you guys see that?
Yep.
Okay, you can see the references?
Yes.
Okay, so these are our references we used. And so I just want to make sure that we show you guys the sources to make sure that all the credit goes to them. All right. Well, I hope you really enjoyed. Okay, I hope everyone really enjoyed our presentation. We're looking forward to your comments, your questions, and we really enjoy working together, and I hope you enjoyed the information as well. All right. Thank you so much.